Welcome to my channel, BodyTalk. Joint disorders are a collection of illnesses that impact the joints and result in limited mobility, discomfort, stiffness, and inflammation. Pain, edema, stiffness, and restricted range of motion are typical complaints. Age-related degeneration, injuries, immunological reactions, metabolic abnormalities, and genetic predisposition are some of the causes of these illnesses. Causes and symptoms. The following are the most typical indications and symptoms of arthritis. Joint discomfort, reduced range of motion, or stiffness in a joint's range of motion. This is inflammation or swelling. Discoloration of the skin, sensitivity to touch or tenderness around a joint, a sensation of warmth or heat close to your joints. The type of arthritis you have and the joints it affects will determine where your symptoms appear. What is arthritis's primary cause? The causes of arthritis differ based on the type you have. As you age, osteoarthritis develops naturally, because lifetime use of your joints can wear down the cartilage that cushions them. If your blood contains an excessive amount of uric acid hyperuricemia, you may develop gout. When your immune system unintentionally destroys your joints, it can result in arthritis, particularly rheumatoid arthritis. Viral arthritis can be brought on by specific viral infections, such as COVID-19. Arthritis can occasionally occur without a known cause or trigger. Physicians refer to condition as idiopathic arthritis. Which factors are at risk? Although arthritis can strike anyone, certain variables may increase your risk, such as tobacco use. Using tobacco products, including smoking, raises your risk. Family history. Individuals are more likely to get arthritis if they have biological family members who have it. Activity level. If you don't engage in regular physical activity, you may be at a higher risk of developing arthritis. Additional medical conditions. Your risk of developing arthritis is increased if you have autoimmune illnesses, obesity, or any other condition that affects your joints. Some individuals, such as those over 50, are more likely to develop arthritis. Women, sportsmen, particularly those engaged in physical sports. Individuals who engage in physically demanding occupations or perform tasks that strain their joints, such as standing, squatting, spending a lot of time on their hands and knees, etc. What is the typical onset age of arthritis? Any age can be affected by arthritis. The type you have and the cause will determine when it begins. Adults over 50 are typically affected by osteoarthritis. Adults between the ages of 30 and 60 are typically affected with rheumatoid arthritis. Near that particular trigger is typically where other sorts that have a more direct cause begin. Gout doesn't appear until after high uric acid levels have been present for at least a few months. And patients with post-traumatic arthritis don't get it until after their joints have been harmed. Discuss your individual risk for arthritis and when to begin looking for symptoms or changes in your joints with your healthcare professional. If you enjoy this video, please subscribe my BodyTalk channel for more body insights. Thanks for watching. See you in next video.